1st, 2022 Town of Littleton Board of Health meeting. 7 o'clock, we'll get started. We have an amended agenda to reference the vote the school committee took last Thursday, which was a request for a variance for all of Littleton Public Schools to offer mask flexibility to students and staff. Do we have anyone from the school committee here to start things off?
I can promote Superintendent Clenchy.
Yeah, that'd be great.
And we have the chair of the school committee as well, Matthew Hunt.
If Matt's here, yeah. Hi, good evening, Dr. Clenchy. Good evening, Matt.
How's it going, Mr. Baker?
It's going well. I wanted to bring you and Dr. Clenchy in first just to go over the request that you guys had voted on at the school committee meeting on Thursday.
Yep. So I can just give you, it's similar to the one we stated before. Just basically, we support a motion to request the Board of Health to grant a waiver to implement indoor mask flexibility at the Littleton Middle School and Littleton High School, as well as our other two schools once a DESE waiver for mask flexibility has been granted. A condition for those students to take part in the mask flexibility would include participation in the district's pooled testing program. Indoor mask flexibility would also be offered to all staff and students regardless of vaccination status. Anything you want to add to that, Dr. Clenchy?
Just that the exception to taking part in pool testing would include students that had tested positive for COVID within the last 90 days.
Does anyone on the board have any questions, comments, like to make a statement? Mike, go ahead. Still having trouble hearing you, Mike.
Something wrong with the computer, probably.
Nope. Nope, still can't hear you. While Mike figures out his audio, anyone else on the board have a question, comment?
I want to see what the superintendent had to say, Kelly.
Okay, well, no, Matt, go ahead.
Yeah, I'll ask something just procedurally. I just want to make sure because I'm newer to the process. The original public hearing was on the high school, but then this afternoon that was changed to effectively all public schools in Littleton. Is that enough notice for a public hearing for parents who are not necessarily in the high school to expand that scope?
It was the opinion of town council that if we felt it was a nature of a sort of an urgent nature or something that we wanted to take care of, that we could go ahead and amend the agenda and get it up there for tonight's meeting.
It's important to note we haven't applied for an attestation waiver from the state for Russell Street School or Shaker Lane School at this time. The middle school attestation waiver was approved by DESE. That's why we've included the middle school in the motion tonight as well.
Testing 1, 2, 3, 4.
Yeah, we got you now, Mike.
You got me?
Yeah. Audio,
Okay.
Anyway.
Sorry, folks.
Do you want to just turn your video on and move forward with your comment or question? Thanks. Go ahead, Mike.
Oh, I'm sorry. I thought other members had already preempted. So, yeah, I think that the absence of metrics, at least I didn't hear it while I was unplugging and plugging. If I've been given metrics about what you're going to use as a guide for monitoring what's going on, it skipped by. Dr. Clenchey, do you have any idea, or have you decided what it is you're going to track?
Well, we're going to continue to track, obviously, a number of positive cases, vaccination rates, et cetera, et cetera. The state was very clear when we met with them, I guess more specifically DESE and DPH, that they weren't recommending that we set benchmarks, but continue to monitor the situation as it allows us. So.
Yeah, well, they're not directly responsible, or at least they're absolving themselves of responsibility for Littleton and the surrounding towns. And I'm not sure that their particular position has relevance anyway, since it looks like their purview has expanded, let's put it this way, for the state. Let me suggest that in order to this is, after all, not a mechanism to discard masks. It's basically to acknowledge the fact that we're into a very different set of circumstances and environment, and we still want to keep students and staff as safe as possible. At the same time, make sure the schools stay open and the students have a chance to basically return to something approximating, quote, normal, whatever that is. So let me suggest that we take a look at prevalence of cases as a metric. And the reason for this is very simple. Prevalence gives us a measure of spread. And the reason this is important has to do with the students who basically will elect basically to go unmasked. I don't know how many of them will or won't. So the idea of prevalence basically is to monitor how much spread is occurring in the schools. If right now it's sitting somewhere in the vicinity at the high school at a very, shall we say, it's dropping. It's already somewhere around 4% according to the data I've seen. The closest competitor in your school system, no big surprise, is Shaker Lane. So they almost have a head start on the high school right off the bat. So the question is that if we institute the opportunity to have volunteer masks, if the prevalence continues to decline, you're basically showing very clearly that the situation is in fact what we think it is. That is, the vaccines and other measures can take care of whatever, shall we say, opportunities there are for infection. So it's the contrary to what we had like a month ago, where we were worried about increasing cases. Here, where we're aiming for is evidence for prevalence dropping, continuing to drop, or stay stable, one or the other. The second thing is that I don't quite understand the ethical aspect for basically putting students who, for whatever reason, have elected not to be vaccinated, even though they're eligible, to put them into a situation where basically they become test subjects. I want to make sure that they understand very clearly what's going on in terms of being around folks who may or may not be masked and who may be, because of their vaccine status, for all intents and purposes, could be carriers. So I'm not quite sure at this stage, since we're running a test, as it were, a trial for a period of time, which also is missing, I believe, from your proposals. I'm not necessarily against, or don't want to, shall we say, voice a strong opposition to the idea of having unvaccinated students required absolutely to have masks on. I just want to make sure that we're not creating a lose situation for them. because I don't know to what extent it will be recognized that their situation is completely different what it has been up to recently, when everybody was wearing a mask. So I don't particularly, and the reason I'm making these remarks, I'm also looking at our town. Littleton itself is showing the same overall characteristics of a drop in the number of cases in prevalence. Of course, the numbers are very different because it's obviously demographically more mixed, but the trend is the same. And I also have taken into account in making the proposal for having a metric of a continuing decline or stabilization of prevalence. I've taken into account I've taken into account the fact that the town itself has shown a lot of resilience and effort to basically reduce the number of cases through rather widespread, but not necessarily 100% or maybe even 90% masking in the appropriate conditions. And this is the environment into which the students go after they spend 5 to 8 hours, 5 days a week. I haven't included athletic and other extracurricular events. So they're walking into, and at least in town and other towns where they may travel, into a different environment. So as far as I'm concerned, I'd like to see the proposal amended to include a metric. I'd be happy to join into the discussion. I don't want to turn this into a big formal fight, but I'd like to basically have this discussion because I want to make sure this is successful and that we can then apply this to other parts of the school, other buildings in the school. I'm really impressed with Shaker Lane, and I'm almost half tempted to give them first hit at the mask mandate option, simply because they would benefit enormously, probably more than the high schoolers might, but I don't want to oversell that. So my proposal is amendment for a metric of a prevalence that continues to decline or stabilize at the level at which it is. If it doubles, I would have to say then if the prevalence doubles at any time during the shall we say the trial run, then we have to. Then I think the Board of Health would have to consider reinstituting the mask requirement into the school, into the building. As far as time is concerned, I'd like to see it start as soon as possible. And also, I understand that we have a vacation period coming up, right, Matthew?
Oh, sorry,
No, it's okay. Sorry, it is sort of tedious.
That's correct. Yeah, we have a vacations 18 days. So.
Okay, so if you institute this, the other, we can either I don't know if this is feasible for you. I'm not trying to put the rush on it, but if it's feasible for you, it'd run through. I realize you don't have control over what goes on in the during the vacation period, but it certainly would allow us to see what the real world is like for this flex mask test. If, on the other hand, you want to start it after vacation, it'll allow the measurement of prevalence in the schools at least another week, I guess, to see what's going on. That might give you a better number and more confidence that the number will continue to decline. But but a metric and time to me are essential, regardless of which school we start with. Thank you for the time, Mr. Chairman.
Thank you.
Any other comments from the board?
Well, is there any way we can find out from Dr. Kelly here? Let's see how many people got sick and how many people are tested every day. If somebody's sick, they should know. The parents should know. If they're sick, they should stay home. Let's see what Dr. Kelly says.
Sure, Gino. We pull test students that are part of the program once a week. We do 2 tests. One's a general test of so many students or staff in a pool. If anybody tests positive, we've already done a second swab, so the lab does a PCR test. We are in the process, in fact, this week, we're implementing weekly testing of staff or people that want to opt in. Week after, we're going to test all students who would like to opt in with at-home tests once a week. So we're testing quite a bit with the new program that we're adding in terms of take-home tests on a weekly basis. So it's incredible what we're doing to keep tabs on who is testing positive and who isn't. Plus, we look for symptoms in our schools. I believe our schools are one of the safest places to be at this point in time. There's no other entity except for colleges, and I don't think colleges are testing as much as we will be in the next 2 weeks. Now that I have your attention, though, I just want to clarify something that Mike said. I know, Mike, that the Department of Education and the Department of Public Health may not be directly responsible for our community, but they're responsible for the citizens of the entire state for safety. So I kind of disagree with that statement you made. I also want to point out that as of January 9th, 2022, in the state, 503,312 test and state tests have been conducted. 98.6% of those tests were negative. Once again, indicating schools are very safe for students. And I understand that we want to do everything we can to keep everybody safe, but at what point in time do we have parents make determinations on what's safe for their students? I mean, we have dictated what's happening in our community since school started. And as a Board of Health, you've made a mandate or a waiver, whatever you want to call it, that everybody shall be masked in indoor spaces. I believe it's helped, but I also believe that it's time to continue to work with each other and have people make decisions as to what they would like to do. Of course, if our cases start to rise, I don't need a metric to follow. We would mask until those numbers came down. So I understand that we need to monitor prevalence of cases and look for a stabilized situation or decreasing situation. Again, it's going to be a steady state. And that's really what's going to happen as we forge ahead. But it's time, in our opinion, school committee, and I back the school committee's decision. It's a joint decision that we start offering a little more flexibility. We're continuing with our other mitigation strategies as I listed in the letter. So I'm not convinced we need a trial. I'm convinced we need to start moving ahead, minimize the number of conditions and pool testing. We're testing every week. I think that's sufficient for our environment to be safe. And again, if something happens where our cases start to increase and we become concerned, we're responsible professionals here, and I have a school committee that's also very responsible. We will take the necessary action or corrective action to make sure that we contain the virus. As we've all stated many times, the virus is coming into our schools. Our spread is minimal. Thank you.
Mr. Chairman.
Yes.
I think, Mr. Clenchey, I appreciate your heartfelt remarks. I certainly would like to see a mask removed not only from the schools, but from the town. But the cruel fact is that we have no idea what the next, if and when another variant, I'll say if another variant pops up. Right now, I can tell you that the B2, which comprises at the most in this country about 8% of hasn't really shown any sign of spreading that would alarm experts in the field. However, that doesn't mean that there are others coming. And the difficulty here is that unfortunately the tests that are available don't distinguish between the current dominant variant and the new one. And we have no guarantee that the next one will. We cannot prepare for that which we cannot see or hear or know until it's almost upon us. That's the difficulty, that the testing is the weak link in the process of testing, and there's nothing we can do about it. And I'm not suggesting that the testing program that you have in mind is spurious or in any way useless. It's very powerful and useful. All I'm suggesting is by tracking prevalence, a metric that tells you what's going on, it's independent of shall we say, the type of testing that you're doing. It tells you what the virus is doing, period. I do see the mask coming off in the schools. I don't have any problem with it. Making it long-term or committing yourself to a period, we'll say we're just going to have the mask off, and gee, if something starts going south, we're going to change our mind. What comprises going south? What is it that would trigger you to be alert? And very frankly, with testing, test what testing can detect. Okay, what is very important is the prevalence of the disease, which very often may or may not match up with the test that you have, depending on the characteristics of the variant and other factors. So the suggestion that's being made to use prevalence is basically a rather modest one. It just simply says that if spread is not occurring at an accelerated rate, the mask can stay off. If all of a sudden you see an uptick in the prevalence, the alarm bell should go off. What's missing? What's not working here? And a doubling of prevalence would put you at a 14% incidence in your schools. I don't think you'd tolerate that. You'd probably be concerned and start asking questions, and you'd be well placed to do that. So please take my remarks as I'm not opposing continuing or not asking that we continue on as usual. And I do like to see the masks, the option to have the mask off there. But on the other hand, I'd like to just basically have a way of monitoring what we're doing to the best we can, even though we don't see the future as clearly as we might.
Thanks, Mike. Yeah, I agree that some sort of monitoring, some sort of figure, would be in order to just see where things stand on case counts and transmission. Any other comments from the board? Dan, did you have your hand raised?
Can I make a comment, Mr. Chairman?
Sure.
All right. Thank you, Mike, for what you're doing. Mr. Kelly, he knows a little bit about his students. Can I speak to Mr. Kelly there?
Dr. Clinchey? Yeah.
Sure.
Okay, this is Gino. I know you know your students, okay? The question is, let's put it this way. When the kids going to go on vacation? When? What day?
Weekend.
February 18th.
20th or 18th. That's right.
The 18th of what? February?
Yes. Yeah.
I'm only suggesting, okay? I'm only making a suggestion.
Mhm.
Let's say, for instance, the board would allow you to have a variance to a point where 1 week, find out without the mask, and find out, and you also have the children tested. If nobody gets sick in that week, we go week to week. Will that be okay with you? At least you have a slang, in other words, oh, this week went good, maybe next week will go good too. You never know. And when the family also should know if the kids are sick, they should stay home.
Right.
And you test them anyway. The question is, make sure that nobody gets sick. So let's do it. I understand a lot of people call me and they talk to me because they say, you listen, nobody else listens. They're tired of the mask, but the question is, we are concerned about the people getting sick. So we have to be careful too. But because you say the school are the best place to be safe, and I believe that. Okay, let's say next week you have let's say the mask will not be necessary for the children, but let it remind them, somebody gets sick, the next following week is not going to be without the mask, they have to put the mask on. I'll leave it up to you.
Thank you, Gino. And I'm not against looking at prevalence of cases. I want to be clear. When Mike gave me a little more information about percentages, it makes more sense. But prior to that information, I was looking at our low case counts and 2 cases in a school. And if you double, you get 4, you double, get 6. That's far too low to be concerned about what's happening. I mean, we've been successful since COVID has started, and I know you're giving us credit for that, but I would like you to continue to give us credit for that. I mean, the school committee oversees the superintendent, and they're responsible for policy. and budget. I want to work as a group. I think that's important, but I also think the school committee should have some opportunity here to help shape what we feel is necessary to keep our students safe. We're not going to do anything. We haven't in the past. Why would we do it in the future to put our students and staff at risk? And I know you understand that. And when I'm citing things that the state is saying, I'm citing them because I believe they've done their homework. They have a team of doctors also. I don't have a team of doctors that I'm working with. I depend on them to give me good information.
Yeah.
I think we need to consider that advice. So that it's been directly indicated to us that we should be spending more of our time looking for symptomatic individuals and less time doing some of the things that we did in the past, but we had to do them in the past. What we're suggesting is we don't need to do them in the future. So we're not in any way saying we're just going to let things go. We're going to monitor them. And again, it's up to the school committee as well. I'm one party in this decision-making process. The school committee is the other party. And I'm going to turn it over to Matt to make a few comments at this time.
Thank you.
Yeah, I think really what we're looking for, Gino, is just having more flexibility. I think that, as Dr. Clenchey said, I think we are prepared to deal with it. And I think we've always planned on using some form of metrics to measure the prevalence. But the truth is we don't know what's going to come down the line. We don't know what the next variant will bring. And I think what we're trying to avoid is, having to continually go back and forth, have a middleman, and just being able to deal with it on our own, because I trust the administration to make a good decision, and the school committee, we all work hard. We all try and keep up on everything. And I feel confident we're not going to let things get out of control. If we start to see our cases doubling, then we're going to take action.
Right.
I think that's how we feel. We're just trying to, I think, simplify this, because I know there's been some confusion and to going back and setting dates, and so we kind of tried to simplify the motion to make it easier to be able to act when appropriate, so that we can have the kids unmask when it is appropriate and leave it open to that.
I'm sorry. I'm trying to, is it clearly understood what prevalence is? Because you guys are stuck on case counts. Case counts, I have not mentioned case counts here at all. I mentioned prevalence, which is a number of cases per, and it's normalized so you can compare each of the schools. Okay. So all it is, it's the total number of cases per population. So you could go from 2 to 4 cases in the high school. That has no significance to where we are today. That would tell you practically nothing. It's the prevalence. That's a very small increase in prevalence. It wouldn't even be noticeable. Okay, the place it gets noticeable is in a small school where it becomes a big deal, but that's not what we're talking about here. We're talking about a whole building, whether it's Shaker or the high school. So I hope you understand the notion of prevalence is not case counting. It's how many students are in the population, how many people are in this population, and that's you can call it the denominator if you wanted to, and then you have n number of cases, and out of that you can calculate very quickly a prevalence number. Right now, your prevalence number in the high school, the last one I had, which is the 2-week prevalence, is that the high school is sitting at 4.2%.
Yeah, but Mike,
That's within 2%. No, I don't know. From the remarks I'm getting, I'm not sure that the metric we're using here is convenient. That's all.
Right. I understand what you're saying. I'm just saying that as case counts increase, the prevalence in the schools would increase. So if the prevalence is not going to go down if the case counts go up. So I think that they're kind of related. That's my understanding, unless I'm completely not getting it.
No, you're not, because the denominator gets normalized so you can compare across different populations. I don't want to belabor it. This, by the way, is a much more flexible number. This more is a meaningful number for you to use to monitor what's going on, because very clearly, if the town and if the schools are going down the same way the town appears to be, your prevalence rate in a couple of weeks will reach something on the order of maybe 2%. Okay, which is great, fabulous. No one's going to bother you with that. No one's going to, if you're, the only argument we could have is what is the base prevalence going to be? I happen to pick the one that you've got here at 7%, and for the high school, or 4%, I think. Excuse me. Let me see. For the 2 weeks, it's 7 point. For the high school, it's 4.2%, and the trend is downward for the whole state. Okay, and the trend is downward for the town. So it's a winning situation. If you want to set it higher to give you more room to maneuver in, that's fine.
And I'm certainly not opposed to using that. Like I said, I think the school committee and Dr. Clenchey, we always talked about having some kind of measurement to track. But again, I'm only here as the chair, and Dr. Clenchey is here as the superintendent. And I don't have the rest of my board members with me. So I don't know what the process would be. Like I said, I would trust the school committee to make an informed decision on what metric to use, but that's certainly something that we would look into.
Well, it's the Board of Health responsibility, Mr. Chairman. This is an issue of public health, and as far as I'm concerned, this is, at least if you want to work together, at least this is the time to work together. I mean, this is not, shall we say, us putting our thumb in this and saying this is that you have to accept a particular number. I'm just asking for a particular approach, and it just so happens you're at a number which is actually very, very good.
Dan, did you have a comment? Did you have your hand raised before, Dan?
I did. I have a couple of questions. Let me start with, in this case, I disagree. I think I agree with Matt and disagree with Mike as far as a trial. I think once we go live with this, I don't think necessarily a time-based endpoint is meaningful. I think if our cases are, below the threshold, which I think we should have some fixed circuit breaker threshold, but if we're going week to week and our numbers are below whatever that threshold is, I don't see a reason to have a time-based endpoint. There's no reason to. If it's being successful, we shouldn't have to go, yep, it's still being successful, we can continue. So just making that clear. I think once we start, I think as long as we have an endpoint metric other than we'll watch it, I as a public health folks, I think that's a little bit loose for a variance of we'll watch it and we'll act appropriately based on some metric which we're not going to really identify. Is a little bit more concerning for me, and I would love to see if we can come up with a metric. I agree. I think 2% per school building is pretty reasonable. It's a relatively low case count. It's a relatively low prevalence, but it's certainly not a tiny number. It's not a zero number. It's truthfully 2% is 10 cases over 10 days over the previous 2 weeks. That's someplace that we're looking at the numbers from today, and odds are the numbers for the way our trends are going, that we will be there momentarily. But I think having some fixed circuit breaker is important. I think, and it's a lot of places to put on school nurses to have their say, Superintendent Clenchey and the school committee all getting on board for a public health metric, that I think that's something I would rather see us all agree on and have part of the waiver than have a number climb and now have multiple different pieces of administration all trying to come up with, is this a trigger that's significant enough for us to act or not? For me, as a Board of Health member, as a public health person, a little bit more concerning. I did have a couple questions for Superintendent Clenchey and for Matt, just so that we're clear that I know the motion that came from the school committee was a blanket mask waiver, no criteria, no guidance, no metrics. It was basically just the school committee was requesting on behalf of the school department a blanket, it's up to us to do as we see fit. I did have a couple questions because Superintendent Clenchey mentioned pool testing was going to be continuing. I do not believe that was part of the requirement to participate. Is that so correct? I'm not saying it should or shouldn't. I just want to make sure that we've got our ducks in a row, what was said,
Yeah.
and what we're actually talking about.
Yeah, we had it on our list of conditions that we presented before. We agreed at our school committee meeting we would continue to do it. But I just want to not pause, but I'm wondering, listening to Mike, I had 2 meetings today. Mike was at both meetings, and the theme I took from the first meeting is the key to success is vaccination rate. And Mike, I don't want to paraphrase you, so if I misinterpreted what you said, please correct me. We have a very high vaccination rate in our schools and in our community. So I think we can check that one off at this point in time.
Yep.
We're talking about prevalence, and I do understand what that is. And I'm not opposed to it at all. But I guess a question I ask, I mean, we've introduced pool testing, we're introducing take home rapid tests on a weekly basis, but I'm getting the impression that testing, including pool testing, is a secondary measure that maybe is worthy of discussion, or is something that we should be concerned about as much as we are. And I just need to get some feedback from the Board of Health. Are we presenting conditions that are secondary rather than primary conditions? And I'm not sure after the conversation that I've had today with Mike.
Yeah, I'm sorry. Testing does not give you safety. Testing tells you who has the disease. Okay, it's linked. It's one of the links. It's one of the links to transmission. Period. Okay, but it's not
asymptomatic cases. Then it does give you safety.
Yeah, I mean it's a valuable tool. It tells you where you are. Okay, it's the tool you use other than reporting about what's going on.
Right.
It's not de-emphasized. I was zeroing in on the metric because it was absent from the current presentation, period. That's all.
All right, thank you. I mean, again, we don't have a full school committee here tonight, and as you do with your Board of Health, you vote on items that you want to move forward with, and as a representative of the school committee, I think it's important that the school committee have that same opportunity. I do sense from the school committee, and I understand that school committees have been responsible for schools for hundreds and hundreds of years, and superintendents have been responsible for the operations of schools for hundreds and hundreds of years. So we would like to, as soon as possible, get back to
Normal.
Our legal statutes give us the authority to do. And I understand we're in a partnership here because we have a town-wide indoor mask mandate, and I appreciate that, and we're committed to work. But you can understand our point of view. We have a partner during this venture for the last 5 months, and we would really like to get back to doing what we've been charged to do by statute. So I think that's why you're seeing us wanting a little more freedom to do what we normally do in this situation.
I've never known a school committee to act as a Board of Health. I don't think you have a statutory authority to do that. I think that in this particular case, I'm not interested in winning the or having a battle with you about statutory position. What we're trying to do here is make this as easy and as helpful as possible for the schools to get back to do what they're doing. And all that's been suggested here is a measurement.
I don't mean to cut you off, Mike. Dan, did you get your question answered?
No, I didn't actually.
Okay. So Dr. Clenchey, you're still doing the pool testing.
Right.
So
Yeah,
my question was, again, not saying that we should or shouldn't include it. This really was, I'm just curious if there is an actual plan on what it is. So I just really had a couple basic questions about what flow is, just so we're all on the same page, because what was presented at the school committee meeting was basically, let us handle it. Paraphrase, I acknowledge that, but that was the piece. And what was started with the conversation here included include pool testing discussions and take-home testing discussions. I merely want to just make sure that we're all on the same page.
Sure.
That is not part of the waiver request or anything else. So pool testing participation has no bearing on whether a student would be eligible for math.
Dan, you're breaking up.
Yeah, I can't hear you.
Yeah, I realized I froze. I'm sorry. So I realized I froze and I stopped the question. So
Yeah, Dan, it's still pretty shaky.
yeah, I apologize for that. I'm the challenge
I'm sorry.
of broadband. I'm having the kids get offline. So my question was simply a student's ability to select.
Can you just repeat that one more time? I think we have you back, but
Yeah, I deeply apologize for this. Try one more time. Pool testing participation is not a requirement to participate for a student to participate in math flexibility, correct?
You broke up again. I'm going to try to answer it. Pieces of information I have.
I'm sorry.
Is that students and staff, if they want to have mass flexibility, have to be part of our pool testing program.
Okay.
okay.
Awesome. So I actually have.
Go ahead, Dan. If your internet's good, we'll keep on going. But if it's still shaky and you want to take a break, we can go to someone else.
All right, I'll try one more time. Mass flexibility would be regardless of vaccination status, but you would have to participate in pool or take-home testing.
Pool testing.
Pool testing, right. So vaccination status doesn't matter. As long as you're participating in pool testing, you'd be
Right.
eligible for max flexibility. If you're not in pool testing, no flat mass flexibility at this point.
That's correct.
Awesome. Again, we talked a little bit about the remasking threshold, that circuit breaker. I think we should, we can talk about that a little bit more. Do students have to have parent permission to participate in mask flexibility, in your opinion, or in the school committee's opinion? Or
Yes, we never, our discussions never ever waived from that requirement. So Matt, you can correct me if I'm making an assumption here, but I walked away with the feeling that yes, we would ask for permission. That's what we were doing before.
Yeah, unless the student is 18 years or older.
right. Do you know how many other schools in Massachusetts have gotten the DESE waiver for their 80% option, and how many have actually utilized it?
33 schools have been approved, and roughly, it's funny, it's not broadcasted very well. Who's doing what? Here with a school or two. Cohasset is the latest one that's joining the mass flexibility crew, so to speak.
Okay, so you get 4 or 5 districts with a few schools in each in the whole Commonwealth.
Yeah,
right
most
now?
high schools, 6 to 12 schools at this point in time.
So it's a relatively small percentage of schools who actually have. 33%. 33 have the waiver, have the
Right.
the flexibility, and only 4 or 5 districts have utilized it so far.
No, it's 33 schools.
School buildings. Okay. Yep.
Right. So, I guess if I was to use schools rather than districts, I would still stick with, maybe 5 to 7 schools at this point in time. Maybe there's more I'm not aware of. I don't have a list of schools.
No, just want that sense of kind of where we are on the curve. Are we bleeding edge as far as looking at this, or are we far behind the norm for Massachusetts? And it looks like we're relatively bleeding edge as far as pursuing this in this timely manner. So just wanted a sense of where we were with that.
Mhm.
I think that's all I have at the moment. I'm certainly love to hear everybody else's comments and reserve the request to come back later.
Matt Wason, sorry, you had your hand up before.
Yes, thank you. I think part of what Dan, I was going to feed off some of that, part of what Dan might have been referring to and why is the prior document that we've been working with back in December that I had did call out like the parental consent. So I had some similar kind of questions about things that the language that it apparently had just slipped off the letter or such like that. So I think that explains part of my question there. I also want to speak to the data thing. Thank you, Mr. Hunt and Dr. Clenchy, for your comments. I'm a scientist, I'm a physician, and I think my concern is not about is the school board or the superintendent or the state or is anybody going to do the wrong thing. We all have the students' best interest in our minds. For me, it's just more of a concern that if you get 20 people in a room who all say, don't worry, we'll do the right thing, they'll decide to do the right thing at 20 different times. That would be my concern. And you guys weren't at the meeting last Wednesday, but for other reasons, I kind of brought up just the point of this pandemic has taught me that, gosh, I would love to do a better job at a local, regional, and global level of kind of just setting better goals, having more transparency about things. And so for me, it's if we all sat down and said, fine, let's say prevalence, let's put this number on it. That way, every parent in the community, every teacher in the community, every community member can all be on the same page and nobody gets surprised. And I think it could save us heated discussions down the road potentially when there does potentially become strife between groups of people that just then have different opinions. So I would also say, let's please get a number. That's one of the things that the document that we assembled back in December at least had a metric. It was the case counts or doubling. I know we had discussion about that, but something, and I did note that had kind of fallen off of the latest recommendation. So yes, please, let's pick something. It doesn't have to be perfect. It doesn't have to be permanent. But I think to Mr. Hunt's point, if we can put something like that into place, I'll feel much more comfortable letting this drive down the road, because I know that we're all looking at a similar number. And if something unexpected comes up, you guys are going to spot it, we're going to spot it, and we can work together. But otherwise, we can kind of put it on autopilot. I'll feel comfortable with that.
Yeah, I agree, Matt. I think it's time for us to let the school committee and Dr. Clenchy and everybody that's working really hard at all the schools to do what they do and, protect the students. And I think it's smart to put a number on it, some sort of prevalence rate, percentage that everybody can agree on is a safe number, and put a plan in action to get this done and give the kids some sense of normalcy and take the masks off. So I don't know what that prevalence number is. We in the past had talked about 10 cases. I don't know if that was a weekly number or a 2-week number. What are everyone's thoughts on a prevalence rate that they're comfortable with?
I just want to add one thing. The 2% number is very, very, very low. And I'm not suggesting for a moment you should use that. That could be an interesting goal, but I'm not going to ask you to achieve that. It's the higher it's basically making sure you don't go higher than a certain number. And I want to make sure that number is high enough to give, shall we say, flexibility.
Dan, you had your hand raised there for a second.
Yeah, I was going to say that 2%, I would say if that, whatever the threshold is, I think the 2-week look back is probably pretty reasonable, since we certainly recognize that, our positivity, it's not real time. That by the time a patient or a student potentially is infected and then tests and then gets a positive result, it's not all in the same few moments. So I think we do need some distance for a look back to be able to, both as a trigger, as a circuit breaker to pause, as well as a circuit breaker to reset and go back to flexibility. 2%, looking at the high schools we talked about, that's 10 cases. Certainly up until a few weeks ago, we were well below that number and had been for quite some time, which was wonderful. This last couple of weeks, obviously with our townwide, reaching over 300 cases, it's not at all surprising that our school system mirrors our community and has also been significantly higher. We're trending down pretty rapidly. I would not, like I said, when we began, I would not be surprised if we're back below that 2% threshold, relatively quickly. I think that's certainly a high enough threshold that, again, prior to the Omicron bump, we were consistently below that, for quite a long time. So I don't think that is unreasonably low for our population. But also it recognizes that my concern with going a significantly higher number than that would be, again, that bump. If we're at 3%, that's 15 cases. If we're at 4%, that's 20 cases. By the time we hit that circuit breaker of, let's say it's 4%, it's 20 cases, and we flip that switch, in real time, we know that really that number we're looking at has already gone beyond that number. When we hit 20 cases, our real school number within a week or two is going to be most likely, certainly matches our community, significantly higher than that. So we do need a low enough threshold to be able to stop a bump before it gets out of control. And again, a lot of this is art and science, and it's hard to, how do you predict a curve? Certainly all of us have done math. We're trying to predict that curve. These curves don't work that way. But we do know odds are, if we're going up or if we're in a relatively high number, that we do know odds are our following week is probably going to be higher. Certainly if we haven't done anything to try to stop that curve. I think 2% seems pretty reasonable. I wouldn't want to necessarily go beyond 3% for a school building, because that we'll use the high school as the easy example and kind of where we started the conversation. That's 15 cases in a 2-week look back. That's significantly higher than we had for most of the school year up until the last few weeks. I'd have to do math in my head for the other school to see where that is. But I think that's a high enough case count to accommodate a household or two bump. We've all seen that. You have three high schools in a household. They all become positive. Now we've got an artificial bump from one or two households that would be a low threshold would trigger that. I think, even with 10 cases, that's probably enough to absorb a household or two with a high percentage in one school building without tripping us over. But I agree with Dr. Wason that having some standard, so we're not having that whole, okay, well, I'm gonna play nurse for a second. I'm the school nurse. Okay, at 9 cases, do I make that phone call to Superintendent Clenchey or to the principal? Okay, well, at 10, well, now it's 11. Do I make the phone call? That's obviously you're all looking at it at the same time. You're all looking at the data, but everyone's doing the same piece. Is this the time for Superintendent Clenchey that I called, Mr. Hunt as the chair going, hey, I'm thinking maybe, or is it 9, or is it 12 or 15? There's a whole lot of should I, shouldn't I, and not saying you're not competent and caring and compassionate enough to do that thought process. I would have that piece of going, let's put something concrete, and if we need to change it, we can change it. But everybody's on that same page of what our expectations are. And it can always be lower. You got, if the school nurse says today's the day, even though we're not at that threshold, but I'm really concerned, that also is something that doesn't need to wait till it hits the threshold. But I want to see a circuit breaker.
Go ahead, Mike.
Sorry to prolong our agony here. I think the piece that's missing from my perspective is how much things have changed. First of all, and maybe Dr. Clenchey and Matt can help with this. What really strikes me is what's really changed is the impact that the vaccine has had on this, shall we say, on the severity of the disease, especially among people who are younger. And I want to use the schools as a bucket. And you have to understand, I realize it has variety. And so one question might be, I'm concerned about the staff, which is the entire staff, which is a different population entirely in many ways as far as viral diseases, especially respiratory diseases, are compared to the younger group. So basically you could have among the students, a high prevalence rate, but in terms of absence from school, hospitalization, it could be almost invisible, regardless of the number of people who are reporting by testing. On the other hand, it could be ravaging to the staff. Okay. I mean, you don't need people all my age to have it laid out completely for you. I'm just simply saying that there's a difference. So I think we ought to give the school committee enough room, as it were, with our metric to make sure they have a way of saying, okay, we're not losing students, they're not being absent. They're coming back to school. Most of them, the vast majority, are coming back to school under this prevalence rate. We're not seeing mass emptying of school of rooms, that whole English periods are being, shall we say, wiped out. 10 students all of a sudden missing from one. The idea is to come up with something that you can work with that actually tells you something real about the situation that you've got, which is a younger population mixed in with a somewhat older population, and you need to take both of those into account. So I think if we're going to have a discussion about a metric, let's make sure it's one that makes sense given the status of the vaccine and the age, the demographics of the situation. I'm not looking for discrimination that we're going to treat the staff radically different, just something that gives the school committee an opportunity to say, hey folks, something is going on here, we better take a look.
Thanks, Mike. I appreciate you saying that. And to be clear, I'm enjoying this conversation tonight, and I'm looking forward to trying to get to some kind of agreement. And you convinced me. I mean, it didn't take much. I mean, you know that I'm a data guy, and I think looking at some type of prevalence percentage is the way to go. And I guess I can start by saying when we came up with 11 more cases we would mask, we were still dealing with Delta.
Yeah.
And then Omicron came along, and all of a sudden we were doubling, tripling our number of cases, and we were able to keep schools open. Our students were able to come back within the isolation period that was spelled out in our protocols. Our staff, well, for the most part, have weathered the storm quite well. I mean, obviously we have staff that catch COVID or test positive for COVID, but for the most part, they've been able to come back within that isolation period that we follow. So, it was an eye opener when Omicron hit our schools. I mean, our rates, every time those numbers came into me at the end of the day, I was shaking my head. I wasn't feeling too good about things, but we didn't cancel any classes. We kept school open every day. And I guess that's a sign of not only our resilience, but it also was a sign of what can we handle and handle effectively. And we were close to pushing the limit, I'll tell you, certain days. So I'm not sure whether the 2% is a number that we really need. It could be a little higher. I want to be cautious though, especially if any variants that come along are similar to Omicron. I mean, we've already proven we can handle more than 2%. So I'm really interested. Mike, you must have a number in your mind, a percentage in your mind.
No, all I've got is just raw data because it's been normalized. I have to thank Katrina for gathering this up because it's a key. And just to make sure you understand, this is what was asked for is the reported 2-week prevalence in a school. And the reason I said for the whole district is currently, I'll say this is the date as of January the 28th. Okay, this is a 2-week period from the 15th of January to the 28th. The district as a whole is 5.6%. Big surprise. I mean, it's allegedly 103 cases. Okay. The Shaker Lane has a prevalence of 4%. The winners, as it were, and there were 19 cases. Okay. I'll also point out, I have not heard that Shaker Lane is in a crisis with this. Right? All right, there's a clue. All right. Russell School, 7.4%. They have 31 cases. But since I've normalized the prevalence, you can see we can do the comparison. And finally, The middle school, not finally, the middle school, 7.3% is their prevalence. That's a 2-week measure. And finally, the high school, an excellent 4.2%, 21 cases. So, we're not talking disaster here. It's not. If it doubled, if it went to 8.2, you would start to get worried. That is the prevalence in the normalized for population. So I was basically seeking guidance on the basis of prevalence of what would give you some running room, as it were, so that we could understand. In other words, you might say, look, this is going to fluctuate. So we're going to do you want to do it school by school, or do you want to do it for the whole district? I would suggest doing it school by school because their demographics are so different and everything is,
Yes.
especially the middle school that one worries me the most because for obvious reasons.
So Dr. Clinchy, what's a percentage of prevalence that you'd be comfortable with at the high school? I think we're somewhere between 2 and 4 here.
Now, when I'm looking at these numbers, is it a weekly calculation? Or,
This is 2 weeks,
yeah.
over 2 weeks.
well, 19 cases in 2 weeks.
Yeah, and for the high school, it was 21 cases over 2 weeks, giving you 4.2.
All right, so that's 10 and a half cases a week. I mean, our original number we were looking at per week, 11, anything 11 and over, we would mask. So that was our, for lack of a better word, our delta metric.
Mm-hmm. Yeah.
So with Omicron, I really feel we could handle a little bit more, but I don't have a wide range there. We could maybe per week.
Well, I think we don't want to set anything higher than we are at this current
Right.
state, right? So somewhere in the 4% range would probably be.
I mean, I think I've heard of districts. A lot of districts are not benchmark friendly. That's, I think, the term they use. But I agree with the benchmark here. 4%. Maybe a doable number. I'd like to ask Matt also to chime
I
in.
had 5% in my head, but I mean, because I just feel like we're still in a good spot, even with 21 cases at the high school. But I mean,
so that's 25 cases over 2 weeks at the high school.
over 2 weeks, so 12 and a half. But I mean, if it's 4, I'm not gonna. I think that's doable. I just think it'd just be a little bit tighter.
Yeah, 5. I could live with 5.
Okay.
Well, just to repeat, the district, just to help you out, because the district right now is sitting, not right now, but pretty close to 5.6% is your prevalence number. And this gives you a fair amount of, that's for 100, that's for the district. That's 100. Okay. So I think Matt's number of 5 might give you enough breathing room. I mean, we're not going to sit and say, oh, you hit 5, so that's it. We would get together with you and see where things are and do some biology, understand what variant is out there, what's been going on. You've removed, and you'll know a lot more once you put in the mask option. How many kids, how many students, how many staff actually do it? Okay, you can probably monitor that much more easily than anybody else can, to understand who's doing what to what. And we'll get a better handle on it. We may have to, as it were, say, okay, it's 5.4, but look, we've got our vaccination rate, I'm making this up, to 96% or something. And we're not seeing people go off to the hospital. That's a win. We're living with, the difference is we're living with the virus. Right. What do you want to, what, I mean, to me, Matt's suggestion of 5% looks like a place to start the run.
Does anyone else on the board have a comment this time? Matt Wason.
I do want to just make sure we don't lose one other angle, and that is the most important thing, and from my perspective, is keeping kids in school. So while I totally appreciate that if we have a variant that is not putting kids in hospitals, that's a good thing. But if we set a target that's too high, it does still mean kids are home. Kids are out of school, isolating for days at a time and missing out on activities. So I think it's a careful balance. Now is probably a good time. I wanted to point out that the American Academy of Pediatrics just updated their recommendations a couple days ago. And their recommendations are vaccinations first, of course. But number 2, it's universal mask wearing in schools, period. Universal mask wearing. Because they're focusing on the mental health aspect and the importance of keeping kids in school. So I would be a little more concerned the higher that prevalence number is allowed to slide. While I, again, understand that Omicron is having less of a medical impact on our communities, I would also love a number that we can kind of lean on pretty well, even when another variant comes up. And I appreciate what Mike said about, we maybe having a couple thresholds where at this number, we all have to have a conversation. At this higher number, it's a hard stop. I would be totally comfortable with that kind of thing, just so that we can, keep working as a team and keep tabs on what's happening. Thank you.
Thank you. Does anyone from the board have a motion at this point?
I hope I don't botch this, Mr. Chairman.
Go ahead.
And Matt, maybe you should track me on this, make sure I don't blow it up here. I'd like to make a motion that we accept the the standards and the process described by the school committee and the superintendent with the amendment of a 5% prevalence over 2 weeks. Matt, do I have it right? I want to make sure I have that. 5% prevalence rate over 2 weeks for the high school. In other words, all we're adding to this is what you've got in the document plus the 5% prevalence as the metric to be used to examine the progress of the mass flexing program.
So are you proposing we only address the high school building?
Yes. Yeah, and we can and if people want to continue with the discussion beyond the high school, I'm as a member, I'm here to do this.
Dan, you had your hand raised for a second there.
I was just going to ask if we had any either correspondence. I have not seen any correspondence since early Friday morning, or if we had any public input before we put a motion on the table.
Do we have any public hands raised, Mr. Mullen, Commissioner Mullen?
Since you've asked if any hands have been raised, just about all of them.
All right, well, let's take some public comment.
Jen, your hand was up first. Jen Gold.
Hi, can you hear me?
Yep.
Hi, Jen Gold, 259 Harwood Ave. I'm calling as a parent, not a school committee member. Mike Zeldin, why would you exclude the middle school from this decision? I know that the letter requests a waiver for both the middle school and high school.
I think it'd be appropriate.
I left it. I left it out because we discussed the metric for the high school.
So so discuss a metric for the middle school and then keep them.
Well, I mean, the demographics of each of these buildings is slightly, sometimes radically different than the next.
Okay, go on.
That's it. It's
the demographics.
Demographics,
they're slightly
yes.
younger. So why not add, if you're going to talk about a threshold, or a circuit breaker of prevalence, why not just put it on both the middle school and the high school? Why would you stop at the middle school?
I didn't stop anywhere. We have never discussed the middle school.
The request from the school committee includes both the high school and the middle school. It includes all the schools that are eligible.
But you do have to, I mean, the responsibility for the mask mandate across the town, which includes the schools, basically does this by building. Okay, so it's the condition of the building and the other factors that have gone in. I'm not prejudging or saying that the Russell School is left out or Shaker Lane is left out. I just want to make sure that folks like you have a chance, parents have a chance to weigh in and discuss what's going on in the school with which you have direct knowledge.
Okay, just so both the middle school and the high school have reached the minimum of 80% vaccination rate. So both are eligible for the DESI waiver. So it doesn't make sense to me to discriminate one versus the other.
Well, to me, the 80% is wonderful for Delta. However, we're in a different world. It doesn't, very frankly, the 80% in terms of a variety of factors the fact the vaccination rate is what it is very helpful. What's more important is the vaccine keeps people, keeps the degree of the severity of the disease very low for younger people and also out of the hospital and also hardly, thank God, very few deaths. So I want to make sure that we keep on that. We don't basically do something inadvertently that disturbs that, shall we say, situation.
Thanks, John.
Yep.
Next up, we have Corey. Just a reminder to state your name and address, please.
Hey there, it's Corey Painter, 124 Foster Street. Really appreciate the discussion. And I want to remind everybody that with great power comes great responsibility. It's just really important for us to keep that in mind. And I think this is more for the representatives of the school committee that are present here today, Clinchy and Matt, that there's been a lot of push for max flexibility in times when it made no sense whatsoever. And I'm fully in support of it right now. I think we have to follow the science, and I think you need people that have a science and medicine background to be part of that dialogue. It makes me super concerned to hear phrases like, you just have to trust us, we've got it, when there's absolutely no training whatsoever, but you have people on the school committee who claim to be experts. So I just want to put that out there. I would love to see there be a structure put forward where there was some oversight from the Board of Health, but where it made a whole lot of sense, like making sure that we are allowing our kids to stay in school, stay healthy, stay safe, not stay masked forever, but that there is some oversight. Thank you.
Thanks, Corey.
Next up is Brian Tarlock.
Hi, Brian Tarbox, 16 Fletcher Lane. Couple of comments. I heard a couple of people talking about wanting a clear threshold so that we would all know when we hit it. And then I heard you all get fuzzy about, well, if we hit 5.4, but it's a Tuesday and the moon is full, then we can change our mind. It's like, you can't get squishy. I think it has to be, it's either a threshold or it's not, because that's going to give people too much wiggle room. Second question is, it's one thing to be looking at the students, but if you take the masks off, there will be more people getting sick. That just stands to reason. I got a science background too, and I'm wondering if you have substitutes, because I don't think you do, available for when the teachers get sick. I'm concerned that you seem to want to go against the guidance of the American Pediatric Society. And lastly, in regard to going beyond the high school, I think the agenda for tonight's meeting is in violation of the open meeting law, because it was amended this afternoon. And I'm pretty familiar with the open meeting law, and If you are in violation of the open meeting law, then any decision you make tonight can be challenged and probably will be. That's it.
Thank you.
Carrie LaVoy,
Hi, Carrie LaVoy.
sorry. Carrie, can you hear us now?
I can. Can you hear me?
Ken, sorry about that. It was my mistake.
No, that's okay. You'll just get to hear my address again. Carrie LaVoy, 3 Stony Stream Lane. I'm very concerned about this board going against the Academy of Pediatrics. They are recommending that everybody in the schools have masks for a reason. They want our children in school. I want my kids in school. Last year was incredibly hard on my kids. I have a 2nd grader and a 1st grader. And this is such vital time in their academic lives. We're struggling with reading. We're struggling with basic math. Last year was so choppy. I'm lucky that my kids are healthy kids, but there are kids in their classes that I know are not healthy, that are in cancer treatments, are recovering from cancers on immune suppressant drugs. How are you going to protect those children that have the right to a free and appropriate public school education? This is opening up a huge can of worms for, masks that honestly, the only person I've ever heard complain about masks are adults. The kids don't care. They just want to be in their sports. They want to be in their school. They want to have their lives go on. And if that means they have to wear a mask, they honestly don't care. So I'm very concerned that you're willing to go against the Academy of Pediatrics recommendation that our kids be in school wearing masks. And I'm very concerned that you don't really have a path for them for their academics if they end up in quarantine. If they don't have teachers, they're not learning. They're not in school, they're not learning. And this is a school committee thing, but this is also, I'm counting on my Board of Health to protect my kids in their school and in their town. Thank you for your time.
Thank you.
Shelley Harvey,
Hi, everyone. Shelley Harvey, 8 Birch Road. I couldn't disagree with the last caller more. I have 2 children. I have a 6th grader and a 4th grader, and they hate the masks. And they've actually been asking me all night, what happened at the meeting, Mom? What happened at the meeting, Mom? So they care. I completely disagree with this. Kids don't care. Yes, they care. There are so many negative side effects of masking children: irritability, headaches, difficulty concentrating, less happy, reluctance to go to school, impaired learning, drowsiness, and fatigue. We have to get the masks off these kids. Mike Zeldin, I was with you all night. I totally agree on metrics, but I'm very disappointed. I don't understand your reasoning for just considering the high school at this point. So I just want to put that out there that I know you went back and forth with Jen about it, but I'm still missing your reasoning on not including the middle school in this vote. But please unmask our children. Thank you so much, Dr. Clenchy and Matt Hunt, for really pushing for this. I appreciate it.
Thanks.
next up, Wendy Roosevelt.
Hi, Wendy Rosenblum Isaac, 79 Neshoba Road. And I just wanted to say I very much appreciate the dialogue, and I was actually really disappointed to hear what sounds a lot like the school committee taking less of a collaborative approach tonight and more of a just hand it back to me approach. And as someone who works in a school setting in an administrative role, that's just not something that I've adopted. And when our Board of Health locally has stepped in and said, do you need help making decisions? My answer's been yes, because I'm not a public health expert. I hold a principal's license. I hold a special education license. I hold teaching licenses. I hold counseling licenses, but I'm not a public health expert. And so it concerns me when the information from people who know this in and out isn't just being taken really fully. It also concerns me because the mask flex, which I fully support moving towards, goes directly against the CDC and the AAP guidelines. And the CDC guidelines specifically say in school buildings, regardless of vaccination status, everyone should be masked, period. So we're making a decision to go against what other scientific authorities have tested and shown to be really effective to keep our kids in school and to make that work. I do support going to mask flex, and feel very strongly and agree with the Board of Health that we have to have really clear science-based health guidelines. And with all due respect, I do believe and very much support the school committee and the schools as a whole, but have found it really disheartening that multiple members in the school committee meetings have made proposals as early as August to unmask kids and have cited opinion papers regularly rather than science. So I have to respectfully ask the school committee to kind of continue to reevaluate their stance, work collaboratively with the Board of Health, because what I'm hearing is we're heading towards unmasking. Let's do it in a way that we can measure it, make it safe for everyone, and make adjustments when needed. Thank you.
That was carried. Carrie, can you hear us?
I can. I actually don't know why my hand was still raised.
Okay.
I'm sorry.
Jennifer Klein.
Hi, this is Jennifer Klein from 2 Dogwood Road. I'd like to thank Dr. Clenchey and Matt Hunt for representing parents tonight. I do have 2 young children who are not qualified to be unmasked, but I'm looking forward to them not wearing the masks in the future, as are they. I understand that the American Pediatric Association took their stance, but there was just an article released by the Washington Post and reiterated in the Boston Globe today from 3 doctors in the Boston area that said that essentially what the school committee discussed the other night, which I attended, and they said that the K95 masks, which are going to be distributed, which hasn't been discussed tonight, there's some arriving for the schools, for teachers and students. They protect the wearer, and so universal masking is not as necessary. And this is popular science right now that is not just fringe. So I'd like to reiterate my support of unmasking with the 80% vaccination status and the overall representation in town of the community vaccinating themselves. Thank you.
Thank you.
Next up is Carrie Buckley.
Hi, can you guys hear me?
Yep.
Hi, thanks. Carrie Buckley, 183 Harvard Road. I just want to chime in here and say that I support Clenchey and the school committee and their stance on this. It's very important to point out they're not acting on their own, without knowledge, without data by their side. They are acting with data from the state, from DESI, who have, as Clenchey referenced, doctors on hand who are analyzing this data and making recommendations based on their expertise. This is not something the school committee is just pulling together from nowhere. Secondly, I understand the Academy of Pediatrics has taken their stance, but I can also, as the previous speaker just noted, I can reference many doctors who are finally speaking out about unmasking our children. And the last point I'd like to make is that I completely disagree that children are okay in masks. I have not yet met one single person in this town that wants their children to remain masked. Not one. My children ask every single day. So one last thing I want to say is that the school committee was very clear and was advocating very hard for those who are vulnerable to have masks, and not only masks, but good quality N95 masks. And hopefully we can provide them as part of this program to protect those who need it. And so I firmly support the school committee and Dr. Clinchie and everything that they're trying to do. Thanks.
Thank you.
No more hands raised this time. One just popped up unless you want to move on.
Sure, we'll take it.
Cliff Stevens.
Hi there, Cliff Stevens, 5 Fraser Street. Is there a reason why the motion is for right now? I mean, it's also like the winter, and so there's colds left and right. There's more spreading of that. Like, I totally understand the push for like the spring, and I think about the seniors who are in high school who would want to have a graduation without masks on and be able to see their, you know, their friends and prom and be able to actually have that moment to do that. But for right now, it's like you're about to go on school vacation where everyone is anxious to get out and travel or see people, and you're going to come back. Why not wait until at least like middle of March before you say, okay, we've got enough data for 3 weeks where we're at the lowest levels we've seen, because it's happening week by week. But the reality is that like you could have a spike right after February, and if you're with mask flexibility, you could increase those cases and increase that risk. And then you're going to have to scramble to adjust and say, all right, everyone's back on masks, and kind of going back and forth. So why don't you just wait at least until like middle of March before you actually make that full call? And that way, at least kids will get a chance to enjoy the spring. People will get a chance to travel or do as much safely from the February vacation and move on. And that way, like, you're at least collecting enough data that's consistent, because I think that we're seeing it move in the right direction, but we have no idea if another variant's going to come out. So you might as well just give yourself a little bit more data for the next 3-4 weeks to get you through, and then make that call. Thank you. That's it.
Thank you.
No more hands, Mr. Chair.
All right, we can close the public input, public hearing portion of the debate here.
Mr. Chair, if I may, somebody would need to make a motion to close the public hearing.
Okay. Is there a motion to close the public hearing?
Okay, before you do that, can I say something?
Oh, actually, yeah. Gino, say something, and then Dan, go ahead.
Okay, the reason that I said to the doctor there, can't see that if we gave them the opportunity before the vacation comes, and after the vacation they come and they feel sick and they're going to test them, then they have to put a mask on automatically. So, and then they have to wait until after the vacation. So we give him the opportunity now, whatever he wants to do at the moment, because he's very judgmentally, and he makes sure that the kids are safe. It will not be a stable. The Board of Health will give them the waiver for only for the vacation. If when the vacation is gone and they're coming back and they get sick, I'm sure he will understand that, and he's going to tell everybody to put the mask on. So you can make the motion now. I'll second if you want.
Dan, go ahead.
I was just saying, I don't think we want to make a motion to close the public hearing, because that would close the public hearing. I think we want to keep the public hearing open until we've acted or actively chosen not to act, because that certainly is still part of the public hearing.
Okay.
Okay.
Public hearing.
So, Mike, we heard, Matt Wason, go ahead.
It's another top thread. So if you want to continue what you were talking, go ahead.
I'm a little puzzled here. I mean, not because I'm trying to promote anything, that we've had a motion put on the floor. It's been seconded. We had public input, and now we have the board discussion. And now a motion has been made to close the public.
No, I thought we had to close the, I'm sorry, I misspoke. I thought we had to close the public comment portion.
Okay. I'm trying to understand where we are on this. Sorry.
If I may, Mr. Chair, typically you close the public hearing, you can continue the discussion between the board and take a vote on a motion that is made.
Thank you for that.
So, Mike, we have your motion. I don't know that it was seconded.
I second.
It was seconded.
Okay. Could you reiterate your motion for all to hear?
Yeah, sure. That that the Board of Health provide the variance to the Littleton mask mandate for the town that would apply to the high school as written and presented by the school committee, with the addition that the mask flexing program would start and be monitored with a 5% prevalence rate as being a metric to guide the progress of that flex program.
I second.
Can
For
I
the high
adjust-
school.
Can I
For the
adjust
high
that
school.
motion a little
Sure.
bit?
Please.
If you don't mind? I'll, it's very similar.
Okay.
I'd like to make a motion to grant a waiver to allow Littleton High School and Littleton Middle School to participate in mass flexibility with a 2-week prevalence rate of no more than 4% for the next 3 weeks. And then wait a week after everyone gets back from vacation, see where their numbers go, and start it back up again.
Right.
So that the return date would be Feb 28, so March 7. So take off from 28 to March 7, or March 28th, or sorry, February 28th to March 4th would be masks back on. Get a case count, get the numbers, get the prevalence rates.
Yeah.
If I may, before that is continued, I'll reiterate, and I agree with the comment made.
You're muted.
You're muted, Matt.
Yeah.
Sorry. I'll reiterate from earlier. It may be frustrating, but this public hearing was set out solely with the topic of the high school until a late adjustment this afternoon. And like I said, it's frustrating, especially for the middle school families, but I don't feel comfortable knowing that potential middle school, elementary school parents did not know this public hearing was occurring except for about 3 hours before our meeting.
Mm-hmm.
Yeah, I'm uncomfortable. That's why, frankly, Mr. Chair, that's why I limited my motion just to the high school, because that was known.
Understood.
We can do the second. We can do that middle school later.
Okay.
We could certainly discuss whatever the school committee would like to discuss. Their members are here. They know the sentiment. And
so then I'll adjust my motion to grant a waiver to allow Littleton High School to participate in max flexibility, given a 2-week prevalence rate of no more than 4% until February 18th. Starting back up again March 7th.
with the same prevalence rate, is that what you have in mind?
Correct.
So, okay, we're not going to do 5. We're going to do what? 4 point what?
4.
4%?
4%.
Okay.
Dan?
Yeah, can I make a motion to amend it to include parental permission requirement and the pool test the school vote to put forward as part of the participation?
Okay. Do I need to repeat the whole thing?
You need a second for that amendment?
I give you the second already.
Okay.
Would you like me to repeat the entire thing with Dan's amendments for the record?
Sure.
Motion to grant a waiver to allow Littleton High School to participate in mass flexibility, given no more than a 2-week prevalence rate of 4% up until February 18th, and then starting back up again March 7th, given parental consent of the participants as well as participation in the pool testing program.
You still need a second.
I need a second. Yeah.
I second.
All right. Motion on the floor has been seconded. Roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
Matt Weason,
Matt Waston, yes.
Mike Zeldin,
Mike Selden, yes.
and Kevin Baker votes yes. Thank you, guys.
Do we want to at least open the, just go over the, shall we say, the major components, or however the group sees fit for the other buildings?
Yeah,
As a
well,
discussion only.
Dr. Clenchey, do you still have February 9th on your calendar for us?
Yes, I do.
Okay, can we discuss
Middle
the middle school and potentially some of the other buildings in the discussion at that point?
Sure, that would be fine.
Okay.
Kevin, while I have you on air, so to speak, I just want to make sure I have clarity here. We had mentioned for a couple of meetings that those people that have tested positive for COVID-19 be exempt from COVID testing for the 90-day period. Is that part of our understanding as we're moving forward?
Yeah, that was my understanding.
Sure.
Yeah.
Okay. All right. Thank you.
And you're keeping track of all that?
Yes, we are.
Yeah. And then after the 90 days, they participate in pool testing if we're still in this world.
Right. We're back into pool testing.
Right. Yeah. Okay.
And I take it as crystal clear to parents and students that if they don't want to take the masks off for whatever reason, they're free to do that, right?
Mm-hmm.
Sure.
Okay, just want to make sure that
I would actually respectfully ask that the school district and schools make positive communication about please wear masks if you don't need to take a break. If we could get a communication out, just I don't want to see a general overall attitude of just pure negativity. If we can still try to promote positivity there, saying, hey, we have flexibility, but we all want to be responsible and respectful, and please wear masks when you can. Just some sort of positive messaging, please.
Mm-hmm.
for example, if the teacher in the room asks for it, I think they would honor such out of courtesy and respect, if nothing else.
Yes, yes, we would.
I mean, that's, and also keep in mind when they're out of school, it's to their advantage to sort of lead the pack. They're the generation that we're depending on.
Right.
All right, so we can move on to our next agenda item, I take it.
Can I discuss something?
Sure.
All right. This is only for discussion then, because it's not in the minutes. There is two young ladies that are working for the state and right here in Littleton. And in the office, they have a mask on and they're separated by about 9 feet from each other. And when anybody comes in, because they have to knock on the door because the door is locked, they put their mask on. So what I'm trying to say is there is no need for them because they're working for the state in the office, only 2 individuals. They should not have a mask when they're alone. When somebody goes in, when I knock on the door and I go in, which I do that many times every week, I put my mask on right away and they put a mask on too. So I just don't want them to get in trouble because they feel uncomfortable too. And I was asking, this is just a conversation between us and if they needed to be on the meeting, they can say it themselves. The question is, they're working for the state and not from the town. And that's my opinion. I suggested that I'm going to speak to you, to the board first before I can say yes. And I'll leave it up to you guys.
Yeah, we'll have to detail out all the details on that scenario and have a conversation about it.
Okay.
All right.
Thank you.
So item B on our agenda tonight is discussion and potential vote on COVID-19 public health mandate, emergency regulation of the Board of Health mask mandate. Are there any board members want to discuss this? Have any comments, questions, concerns? And thank you, Matt Hunt and Dr. Punchy, for your time tonight. We'll see you on February 9th.
Yeah, thanks. So thank you. I appreciate the time, and I think this is a start. So we appreciate it, and we have a lot of work to do ourselves. So we'll get working on that so that we can make sure it's implemented correctly and with the right mitigation strategies in place, so that we can get this going and hopefully move on to the middle school and some other ones.
Yes, exactly. Thanks.
All right. Thanks, guys.
Yeah, thanks, Kevin. And I appreciate the conversations we had tonight. I think we have a good plan. So thank you very much.
Thank you.
Good luck.
Thank you.
So discussion and potential vote on COVID-19 public health mandate, emergency regulation of the Littleton Board of Health. Anybody have any questions, comments, concerns on the mask mandate? Want to do anything tonight? Dan?
Certainly our numbers are looking better than 2 weeks ago, but I think we still have over 200 cases as of the last official state report. Our trend is heading down as almost as quickly as it came up, which is wonderful news. Although obviously 200 cases, even minor, are still concerning in town. I don't see a place with the data we have at this moment of change. I don't see we're quite there yet with our bump, even with a friend described certainly the Omicron is, we had a tornado with Delta. Not many cases, but high acuity. We now had a hurricane with Omicron. Lots and lots of cases, some bad, some not, but the volume is still pretty significant. And with big volumes come sick patients sometimes out of that. So I see us as heading the right direction in a hurry, and hopefully, again, within another reporting period or two, we'll be back pre-Omicron and we can have a meaningful discussion. I just don't see how high could at this point in good conscience say we're in a place to really start rolling anything back town-wide with our numbers. 2 weeks from now, it might be a very different place, but.
Anyone else? Mike?
I'm hoping to engage Matt in this as well. From my perspective, the effectiveness of the vaccine and the availability of masks that actually provide protection when properly used, provide a physical barrier in combination with behavior. We're now in a totally different position than we were just a few months ago, even with Omicron. So I just want to note that I've that along with others have worked very hard to extract out some idea of just how pathogenic, I hope that's right, Matt, pathogenic AMI is locally. And the answer appears so far, unless someone here can extract some additional information, is that unlike other places, other towns, that Littleton and many of the surrounding towns are not seeing a great number of hospitalizations or severe cases. And the reason I'm being vague is because the numbers I get are very frankly they're not consistently collected. And getting hospital data right now is virtually impossible out of the state. I have to sort of use circuitous routes all the time. I'm not happy about that. But when it comes to Acton, the main hospitalizations are occurring among people who are not vaccinated, among people who have underlying conditions who are vaccinated, and the deaths that are occurring primarily among unvaccinated as well as vaccinated elderly, for who knows what all the reasons might be. We're in a very different place. The bulk of the population that is vaccinated are so far getting very good protection from severe COVID or even moderate COVID and death. up to the age of about 45 or 50. And after that, the numbers start getting more, shall we say, problematic. So we're fast approaching the point in Littleton where it's not necessarily to define it as endemic disease, but certainly something that we have to take into account in terms of living with it. One of the issues are not just the schools, but also the town in general. There comes a point where the result of having one's life constrained the way it's constrained, loss of productivity and creativity, which can work havoc on a society and on a town. So I want to be clear that we keep in mind where we are, that we do have tools that we didn't have a few months ago. I hope that we do get the masks. People use them. So those masks are very different than just throwing something on your ears and hoping for the best. They work very, very well if you're willing to put in the extra 30 seconds to get the extra fit. So I hope we do have a discussion that deals with the new reality on the ground when we come to discuss the town mask mandate, which at the moment I agree we're not ready yet to, shall we say, consider tonight in a serious way the right time to lift it. There's still a lot going on out there that's not understood.
Thanks. Anyone else? Comments? All right. Then I guess we can close the public hearing portion, not close the public hearing, because we'll probably, Commissioner Mullen, keep that open and just keep it on our next meeting. That's what we've typically been doing for that aspect of things.
I don't see any hands raised for public comment on this.
Okay.
Oh, I do now.
You do not.
Are you taking public comment?
Sure.
Mr. Chairman.
Yes.
So what I said before is going to be on the meeting next time so that we can discuss it for the two ladies.
Sure.
Thank you.
Yeah.
Elaine Weiss-Gartner.
Hello, you're muted.
We're not hearing you, Elaine. Can you try speaker?
Can you hear me?
We can hear you a little bit.
Okay, great. So I just have, I apologize for that. Just quick.
Could you state your name and address, please?
Oh yeah, sure. Eileen Nita Gardner, 25 Maplehurst Road. So when it comes to the trial for the unmasking, and you said it would go to the 18th, when they come back, are the kids all going to have to mask for a week?
Yes.
Okay, just curious. Thank you.
Oh boy.
Brian Tarbox again.
Hi. While the mask mandate is in effect, is there anyone in town that we can go to when we see restaurants just completely violating it? I was in Anthony's the other day. They had 4 cooks behind in the cooking area. One was wearing it correctly, 2 didn't have it on at all, and the other one was wearing it around his neck. You go to the Dunkin's next to Donovan's, and the main supervisor there is, wearing it around her neck. And I realized that you don't want to enforce it and the police don't want to enforce it, but it does have the force of law for right now, I believe. So who can we go to in the town who will enforce, the law?
There's 2 options. You can call the Board of Health and see if Jim Gariffi is in town in the area. He's our health agent with the Neshoba Board of Health. And also this board has made Chief Pinard an agent of the Board of Health quite some time ago, probably about a year ago, when we were, maybe it was 2 years. I don't even know anymore. with dealing with all this COVID stuff. But he is an agent of the Board of Health on record. So you can certainly give them a call. And if they can make it over there, they may even be in the area.
It just that I've heard that they've said they want no part of enforcing it.
I don't think you've spoken to Chief Bernard on that.
No. You know, this town is a second, third hand. I grant that. All right, I'll try it again next time. Thank you.
Thanks.
No other hands raised.
So any further board member comments for tonight? And if not, we need is a motion to adjourn.
I make a motion to adjourn.
I'll second that.
Second.
Roll call vote. Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
and Mike Zeldin.
Mike Zeldin, yes.
And Kevin Baker votes yes. Thank you, Commissioner Mullen. Thank you, Dave. And we'll see you guys February 9th.
Thank you all.
Thank you.
Thank you all. Thanks, Dave.
Thank you.
Thanks, Dave.